Good morning, everyone. My name is David Laxton. I'm the Director of Communications at the Autism Society of North Carolina. Would like to welcome you to this morning's webinar, which is Strategies to Support Individuals with Autism in Foster and Post-Adoption Contexts. At this time, what I'd like to do is hand it over to one of today's panelists, is Kim Tizzard. She's the Director of our Family Support Services. Kim, I'd like for you to introduce yourself and then hand off to the next panelist. Everyone, enjoy the presentation and remember to use the chat feature if you have any questions.
Good morning. We're really excited to be here with you all today. Like many of you, you may hear some noise in my background. I am the mother of a 24-year-old adult son who is on the autism spectrum. I've been with the Autism Society for close to 17 years, and I have spent a lot of my time working with parents and professionals in just understanding a little bit more about their kiddos. So if you do hear some noise in the background, I'll try to keep myself on mute so you don't hear my son. He's very excited today working with some of his program, and I'm looking forward to it. Alec?
Thank you, Kim. I'm Alec Myers. I'm a clinical psychologist and behavior analyst, and I have the good fortune to head up the clinical program at the Autism Society of North Carolina. I've been there for 8 years and look forward to this presentation and your questions. Thank you. Leslie?
Hi, everyone. My name is Leslie Fraser-Ball, and I'm a clinical professional in the Triangle area, and I've been working with the Autism Society for about 13 years now. I'm also a foster parent and provide respite to foster families here in the area, and certainly so this topic is a passion for me, and I'm glad that you're here and looking forward to hearing from you all. I'll pass it over to Louise.
All right, good morning, everyone. I'm Louise Southern, and I'm the Associate Clinical Director for the Autism Society. And I'm happy to be here as well, talking about supporting children and adolescents with autism in foster and post-adoption contexts. Like Leslie, this topic really represents the intersection of my professional and my personal heart in a lot of ways. Because obviously in my professional world, I've been working with individuals with autism since 1997. But in my personal life, I have 3 children, and 2 of them are adopted through the North Carolina foster care system. So I'm just really happy to be here, and we really appreciate all of you professionals and family members who are invested in supporting this population. So what are we going to be talking about? We're going to talk about some basic autism characteristics, but that part is going to be a quick review, because where I really want to spend time is talking about looking at problem behavior through the proper lenses. And really, we're going to be looking at problem behavior primarily through the autism lens, while also clearly giving a nod to looking at problem behavior through the trauma-informed lens and understanding the role that trauma might play in some of the problem behaviors that we see. I am not a mental health provider. I am a behavior analyst and an educator, and so my expertise is in autism and education. It is not in trauma, but certainly given the population that you all are supporting, we have to give that a nod, as trauma a nod as well. And then obviously I'm going to talk about some of the proactive support strategies that we can apply when supporting children and adolescents with autism. And if you're not in the foster or adoption care world of professional or personal, this content is still highly relevant to you, because these strategies are really those evidence-based practical strategies in autism that are relevant for home support, for school-based services, and other settings. So the strategies, the proactive support strategies that I'm going to present are fundamentally, they are intended to prevent problem behavior and to address problem behavior to some extent. And they're also intended to teach new skills, but most importantly and broadly, they really funnel up into 3 core areas. They funnel up into core areas of social understanding, so promoting social understanding in individuals with autism. Self-advocacy is huge, so giving individuals with autism the tools and power they need to be able to self-advocate in the ways that are meaningful and effective for them. That's critical for individuals with autism, and it is certainly critical for children in foster and adoption contexts. And then self-regulation of emotions and behaviors is a critical skill area that we certainly have to provide instruction around, proactive support in when we're addressing this population of children and adolescents. And really, at the end of the day, what we're trying to get at is overarching empowerment for individuals with autism, quality of life, and happiness. That's our aim for all individuals, of course. So very briefly, what is autism spectrum disorder? Certainly, I'm not going to spend a lot of time on this part. We have a lot of other webinars and content around kind of the introduction to autism and the characteristics of autism. So this part will be brief, but as many of you, of course, already know, autism is a neurodevelopmental disorder. It impacts development at a very early point in life. Difficult to know exactly what point that is, but we can see early indicators of autism at very early points in development. There's great research going on even with children as young as 6 months old who are the siblings of older children who already have a diagnosis of autism. And researchers are looking at those young children because they are more genetically at risk for having autism because they have an older sibling who does. And so they're studying these young babies and looking for the very early indicators of autism. So autism is present very early point. It does manifest at different points for some children. Some children might present kind of typically developing up until 18 months or even 24 months or even a little bit older than that. And then they start to show signs or even in some cases regression of skills or loss of skills. But autism is a childhood disorder that is present very early. It impacts development of the brain, which leads to differences in two core areas of functioning, two big buckets of social communication and sensory and behavior regulation. Those are kind of the two big areas, and those are big areas. Social communication encompasses a lot of different skills and characteristics, and behavior and sensory regulation, regulating my emotions, regulating my behaviors, and also sensory processing differences that we see in many individuals with autism. Autism is a spectrum disorder. And so that means that the extent to which an individual is impacted or affected by their autism is different from one person to another. And individuals can be impacted to differing degrees of severity. And so diagnostically, the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, has broken autism down essentially into 3 levels. Level 1 requiring support, level 2 requiring substantial support, and level 3 requiring very substantial support. So sort of looser descriptions might be a level 1 might be someone who is characterized as being more mildly impacted by their autism in either the areas of social communication and or behavior and sensory regulation. An individual who is identified as at a level 3 severity for social communication or behavior and sensory regulation might be characterized as having severe autism. So just kind of to paint that picture differently though, autism is a spectrum disorder. And so right now we're working with 2 different 17-year-old young men in our clinical services. One of those 17-year-olds is going to go on to post-secondary education. He is brilliant in STEM areas like math and science and technology. He's done pretty well academically in school, but he struggles to organize himself around deadlines. Time management is difficult for him. He's still working on understanding some of the rules that govern how he should behave in social situations. That's where he experiences the greatest challenges and where his autism becomes a little bit more clear. He struggles with sort of back and forth dynamic social conversations, struggles to read the cues, the subtle social cues in certain situations. Sometimes his behavior can be perceived as rude or unexpected. So he is still working to understand the social world, and he's working to understand all the hidden rules that nobody ever explicitly taught him about how the social world works. And so he requires direct instruction, explicit instruction to understand those social rules that govern behavior. Another example is another 17-year-old that we're supporting right now, a young man as well, a wonderful young man. He has no vocal language, unlike the other guy who has an expansive vocabulary. This other young man has no vocal language, requires constant supervision to keep him safe. So for example, wouldn't understand yet the rules of crossing the street safely, requires support with many aspects of his life. And we very recently just toilet trained him. So he was in an adult diaper until recently. And so now for the first time, he's using the bathroom independently at the age of 17. He will require support and supervision for the duration of his life. So these are two very different people with autism, but they both have autism. They are both affected in those areas of social communication and sensory and behavior regulation. But the way that their characteristics present to all of us is very different. And I'm sure many of you all are seeing individuals with autism across this full complex spectrum. And I've just described to you two people. Of course, there are so many other presentations of autism along this spectrum as well. Just really briefly, prevalence of autism right now, according to the Centers for Disease Control and Prevention, is at 1 in 54 children. And the male to female prevalence is they're about 4.5 times more likely to be males than females. We could talk a lot about the reasons why we're seeing these prevalence rates, but for the sake of time, I'm not going to do that today, but just wanted to point you to a few facts and figures. And there are some red flags in development, though, that I just wanted to point out, and I'm sure many of you all already know this, but it's just important to keep these in mind when we're looking at very young children. There are some red flags that might be reason for concern. So, for example, in a very young baby, 6 months old, when you hold the baby and you're a known caregiver to them, you expect to see those looks, those gazes back at you, the smiles sometimes, the responses to your voice, the social responses that come in the form of the looks, the smiles, little sounds that a young infant might make, starting to follow you around the room and looking for you. So when we don't see those very early indicators and there's a pattern of that kind of behavior, we might start to be concerned. If we don't see babbling, making noises, vocalizations by 12 months old that are purposeful vocalizations that have some meaning for that child as well and are intended to communicate a message to their caregiver or other people. And in coordination with that, if we don't see it around 12 months or so, those gestures like pointing, showing the ball as if to say, look what I have in my hand, all those smiles and facial expressions, waving bye-bye. If we don't start to see those around 12 months, in conjunction with some of these other red flags, that can be reason for concern. Responding to name, if we're not seeing that happen. If we're not seeing words by 16 months and meaningful two-word phrases by 24 months, then we also, of course, are concerned. These may not be indicative exclusively of autism, but they are certainly red flags in early development. And they're a reason to get, assessment and further screening by a professional. If any caregiver is concerned about a child's development, we always recommend that, you are your child's best advocate. And so it's important to get that child, screened and assessed if you have concerns. And then, of course, if you see any regression at some point, loss of speech, loss of social play skills in that, 2 to 3 year old or 18 months to 3-year-old area, if you see a regression, that's a reason for concern. So very briefly, because we did know that some of you all are new to autism, either as professionals in the foster or adoption world, or maybe you are foster parents and you are working with, you're supporting a child with autism for the first time. I just wanted to show you a quick video. This is on day 1 of intervention services that we were delivering to this young little toddler with autism. We do have permission to show these videos by his guardians. And I just want you to pay attention to some of these early signs of autism that are evident here. You're not going to be able to hear this video. The audio is not transmitting well, and I apologize for that, but it doesn't matter because the videos I've selected for today, it's all about what you see. So I want you to just pay attention to his eyes and his face and his responsiveness to this caregiver. She's singing "Row, row, row your boat" to him. She's trying to capture his attention, trying to engage him. Now she's singing Meals on the Bus. And so in that video, what you don't see are the looks towards the caregiver. You don't see any smiles really. You don't see when she pauses and stops bouncing the ball, he doesn't look to her as if to say, keep going, do it more. There's no laughs. There's that lack of connection in that moment. And she's trying to get engagement by trying to do things that she thinks he enjoys, like bouncing him, the movement activities that he enjoys, singing to him. He likes music, but she's trying to make this a social activity. And right now it doesn't appear very social from his side. So this is 2 months later. And I just wanted you to see this video again, because those of you all who are advocating for children, whether they are young children like this with autism or older children, advocating for high quality evidence-based intervention is important, because the outcomes can be tremendous. And progress, is defined differently for different people. But this is a really nice example of what it can look like 2 months later with high quality play-based ABA intervention that we were providing. So in this video, you're going to see a different little kiddo in a lot of ways. He's going to be, they're playing a sort of a hide and seek game. Some tickles. She's hiding. But he's looking for her. And there's the response. And he's laughing and squealing. He's looking to her. He's using his body to communicate. He's looking right at her. He's engaged. He's focused. She's going to hide again. Where'd she go? He's laughing. So he was seeking her out. There was a different level of communication going on between them than in the first video. He can't talk yet, but he's communicating very well through a lot of other behaviors, the eye gaze, the smiles, the walking towards her, the looking for her, the standing up when she stands up. Those are all those communicative signs that we want to see that really comprise a real high quality social interaction in a young child. So I just wanted to show you one quick example of that. This is what we all need to be advocating for, is just high quality intervention services, whether those are school-based or elsewhere, for children who we are supporting. So we know too, that autism is challenging in some ways because many individuals with autism are unique and needing more services. And obviously, if you all are supporting children with autism in the context of foster care, there are already a lot of complexities involved with regards to their history. In addition to that, we know that fundamental to autism, sometimes we see behavioral challenges that make it harder for caregivers to get their child or adult to basic medical appointments. So accessing standard services can be harder if behavior is getting in the way. Some children are really fearful and have a lot of anxiety or confusion about doctor's appointments, dentist appointments. Very basic appointments like that can be overwhelming and supremely challenging for some. We also know that there are gaps in professional development among medical providers. Not all medical providers are well trained in autism support and services. We also know that there are some problems with polypharmacy, and what we mean by that is that, prescribing one medication, for example, to address mood or behavioral challenges for a child with autism, and then an additional medication is added on in some cases, not to address the core features of autism, but rather to address maybe some of the side effects that the other medications are producing. And so then we sort of have a problem with polypharmacy, too many medications, difficult to disentangle and figure out which medications are actually having the effects that we hope that they're going to have. So there are some challenges there. We also know that there's a higher prevalence of co-occurring conditions among individuals with autism. So individuals with autism can be at greater risk than typically developing individuals for certain comorbid conditions. So some recent research and data from, for example, the American Psychiatric Association points to the fact that approximately 70% of individuals with autism may have at least one additional mental health disorder, and up to 40% may have 2 or more. We also know that the diagnosis of comorbid mental health conditions, whether that's ADHD or depression or anxiety or other disorders, that it can be harder for diagnosticians to assess those mental health issues in individuals who have more severe autism. Because with more severe autism, that typically means that the individual may have very limited or no language. And so if an individual has limited or no language, it can be much harder for a diagnostician to assess a mental health condition. But this is important information for you all to have, and I'm sure many of y'all are seeing this. We say co-occurring conditions such as anxiety disorders, mood disorders, ADHD, specific learning disability as it pertains to the school system. That's an area of eligibility within the school system. So we see a number of individuals with autism who have average or above average intelligence, but within the school setting, they are also identified as having a specific learning disability in an area like mathematical problem solving or reading comprehension or written expression. It means they're really struggling in one or more of those core areas, despite the fact that they have average intelligence. Or so there's a discrepancy between their intelligence and how they're achieving from an academic perspective. We see a very clear increased prevalence of gastrointestinal issues among individuals with autism, seizure disorders, and sleep disorders. And of course, sleep disorders can be not only really challenging for that child or adolescent, but also for their caregivers. Because if the individual is struggling to stay asleep or go to sleep, or is waking up in the middle of the night multiple times, or when they do wake up in 3 a.m., they are up for the whole rest of the day, that's obviously a real source of stress on any caregiver and the family. And I'm not going to spend much time on these data at all, but just wanted to provide you with these, some of these statistics that maybe some of you all are well aware of. But for example, this last bullet here from some recent research, that children with autism may be at greater risk for foster care placement than children who don't have autism, but also for children, that children with autism are at greater risk for foster care placement than children with other forms of developmental disabilities. And it may go back to some of those complexities in challenging problem behavior, comorbid mental health conditions in some cases, and a variety of other factors may play some role in making in what we're seeing here. We also know this as it relates to autism, and as it relates to individuals with other developmental disabilities and intellectual disabilities, that they are clearly at greater risk for sexual abuse and exploitation. For example, the U.S. Department of Justice suggests, based on studies that they did or research that they pulled, that this risk increases by at least 7 times among this population. And we can see some of the reasons why this may be, in terms of that some individuals with autism are very vulnerable because, for example, they may need substantial support and supervision with basic activities of daily living, like getting dressed, using the bathroom. But for children and adults who need that additional support, that does place them at greater risk. And so obviously one aim is to promote as much independence as we can within those basic self-care and grooming and hygiene routines. Other reasons why this population may be at greater risk is clearly because there are social communication challenges. It may be more difficult for a child or adolescent to self-advocate in situations. It may be more difficult for a child or adolescent to perceive and recognize when they are being threatened or are in danger in some ways. Some individuals with autism, even those who have a lot of skills or have above average or average intelligence, for example, may still be very naive from a social perspective, and therefore are at great risk for abuse and exploitation in a variety of different ways. So this is a population that certainly needs our support and protection, and we have to also work to promote independence and self-advocacy in all of its forms. Just finally, really quick, employment outcomes for some individuals with autism. There are some interesting findings here. Again, this just points to some of the unique needs of individuals with autism when we compare them to other populations of people with other disabilities. So you can see here the differences in employment outcomes for people with autism versus people with other disabilities, such as intellectual disability. Individuals with autism are underemployed, when compared to some of those other groups. And what's really interesting is that we're seeing a lot of research, including the study I cite here, that finds that individuals who we might characterize as having high functioning autism are actually less likely to establish and to maintain employment than are people with more severe forms of autism. And it's possible that some of the reasons for this are because individuals who we might characterize as having high functioning autism, they don't present as having a disability quite as clearly to their coworkers or to their supervisors. And so, but nonetheless, those individuals often struggle in the area of soft skills, and that can make it really difficult for them to get and to keep a job. So these are some of the reasons why we see these challenges in the employment area for individuals with autism. It's another reason why those of you all who are professionals and those of you who are caregivers of individuals with autism who are getting towards transition age, starting at around 14 years old, it's really critical that we are supporting them and working with them to get them ready for graduation. What are they going to do after they graduate? Getting them ready for those post-school outcomes of employment or post-secondary education or independent living, for example. And so really briefly, in terms of these characteristics of autism, I'm just going to touch on these because I want to get to strategies and I want to get to looking at problem behavior through the autism lens. And so individuals with autism, again, it's a spectrum disorder. And so the way that these differences present on the surface is going to be very different from one person to the next. So some individuals with autism may have no language at all, or may have very limited language. Or if they do have language, some individuals may not use their language very functionally. They may not use it in the right context. They may not use the right words. Or they might repeat phrases that they've heard over and over again. Or they might script from a movie. I was working with an individual who can script an entire Disney film from start to finish, but she can't tell anybody if she's thirsty. So language doesn't always mean that they have a voice, a real voice to advocate for themselves, to express their wants and needs and their feelings and their fears. So we know this to be true of individuals with autism. We also know that many individuals with autism, like the example I was telling you about earlier of the 17-year-old young man who's going to go on to college and is brilliant, but he struggles to read between the lines in a social situation. He struggles to read tone. He struggles to read the cues of sarcasm. He doesn't pick up on those cues. And he also doesn't display some of those nonverbal communication cues, like using gestures, body language, facial expressions as he's communicating. And so sometimes he presents as very flat in his communication, or it can be difficult to read him. People think maybe, for example, that he is very cold or, quote, rude or very stoic, when in fact, that's not actually the feeling that he's having, but it's how he's projecting himself. And so we're working on that with him to help him understand how other people perceive his behavior so that he can be more successful in those social situations. We also know that many individuals with autism, regardless of where they fall on the autism spectrum, struggle to understand verbally delivered information that's delivered at a high rate, kind of like the way I'm presenting right now, and some struggle to follow multi-step instructions or directions, or to respond to multi-part questions when those are presented verbally. And so a lot of times we see that people make assumptions about in children and adolescents with autism who have lots of language and who we might characterize as, quote, high functioning. And yet many of those children and adolescents still struggle to understand what's being communicated to them. And so that's one of the reasons that some of those children really fall apart in general education classroom settings. It can be very difficult for them to process all that verbally delivered information without appropriate and comprehensive accommodations in place for that child. We know that many individuals with autism exhibit forms of inflexibility or rigidity in their thinking or in their behavior. And this comes in a lot of different forms. So inflexibility, I was working with an 8-year-old little boy. We were playing with his train set, and I used the train in a different way other than a way he's ever played with it before. The train became an ambulance, and it was trying to help the sick people. And this is a child with a lot of great skills, but he really struggled in that moment to understand why I was playing with the train in that way, because he was saying to me, it's a train, it's not an ambulance, it's a train. And I was pretending it was something else. And that was really hard for him to grasp. And so, you know, I could see that he was getting frustrated. So I shifted and I honored his communication in that moment. But there was that example of inflexibility where he just wasn't ready to see that toy in a different way other than the way he has it in his mind to be. Inflexibility also can come in the form of, I was working with a high school student who's a very intelligent young man, but when he would receive criticism or feedback on his written work from his AP English teacher, he would argue with her, and he struggled to take on another perspective. He struggled to make edits because he felt like his way was the only way and it was the right way. So it was a lot of difficulty in teamwork and group work situations for him, accepting feedback. And so you can imagine how that might play out in the future for him in terms of developing meaningful relationships. How well is he going to do in college if he can't accept feedback from his professors? So it can come in that form. Inflexibility also can come in the form of more kind of classic examples. We're working with a little guy right now who primarily just eats food that is the color orange. He will only eat food that is the color orange. He's very inflexible in that regard with regards to his diet. And so, or an individual whose parent is driving them home from school a certain way every single day. And on a given day when there's road construction going on, if the parent has to change their route, that might produce a lot of confusion and frustration for that individual. And they're showing a lot of inflexibility in that moment because they don't understand, why are we going a different way home? So this can come in a lot of different forms, but it's a kind of a core feature of autism that we see levels of inflexibility and rigidity. And we see difficulty with sensory processing for sure. And this is very individually determined. Some individuals with autism need to engage in certain repetitive sensory behaviors. Maybe, for example, like pacing or rocking or hand or motor, like kind of hand movements or hand flapping. Some individuals do that when they're excited. Some individuals do that when they're upset. Some individuals do it in both situations. Some do it to calm themselves down. And so those kinds of sensory behaviors, unless they are unsafe in some way, or unless they are significantly interfering with that person's ability to do anything else, then those aren't necessarily behaviors that we're trying to interrupt or reduce. Rather, we want to honor the need for those sensory behaviors. And in some cases, we try to help that person find the right time and place to do those behaviors, because we know that for many, it can help keep them calm and regulated. But we also see some individuals with autism engage in sensory behaviors that maybe we have to intervene around. We're working with a little guy who used to lick everything that he came into contact with. It was his way of kind of processing the sensory world, and he would literally lick a doorknob, lick the wall, lick objects. Obviously, that's unsafe, and you know, we have to support him and intervene around that. And so we found some creative ways to do that. Or an individual with autism may struggle with their environment, and if there's certain lighting or certain sounds in the background, it can be very difficult for some to stay focused and calm if there's that distracting, extraneous kind of environmental stimuli going on. And there's a lot of accommodations that we can provide to individuals with autism to support them. And that's where professionals like occupational therapists become very important, is helping a team of people to address those sensory needs. So fundamental to all this, yes, please.
This is Leslie. We had a question in the chat just about a previous slide before you moved on. Just to clarify, the question was about the risk of sexual abuse for individuals with autism. And just to clarify, the research tells us that individuals with autism are at an increased risk of being abused by caregivers, and certainly not the other way around.
That is correct. That they are more vulnerable or at risk for abuse and exploitation in a variety of forms. Yes, by caregivers, by adults, and others. Yes.
Cool. Yeah. Feel free to put other questions in the chat as we go.
Yeah, please do. Please. I like the questions. It's very hard to just talk at a computer screen for 2 hours. So, you know, keep them coming, people. So yeah, I mean, a mantra around autism services and understanding autism, you know, I've tried to paint a very quick picture of autism using different examples across the spectrum. But really, you know, if you've met one person with autism, you've just met one person. And it's just important to keep that in mind, of course, that there are core features of autism that are fundamental to this disability in the areas of social communication and sensory and behavior regulation. But there are also tremendous strengths that many individuals with autism exhibit. And I'm certainly, I want to emphasize that point as well. and that a person with autism is a person first. And so they have a lot of other characteristics and interests and needs and history. And their autism alone may not define who they are. So having briefly touched on autism and core features, trying to help everyone in the audience, look at problem behavior through the right lens and thinking about problem behavior objectively, but with autism in mind. And also given the fact that many individuals with autism who you all are supporting in foster and adoption context have experienced trauma, keeping that in mind. So the question is, why do challenging behaviors occur? And fundamental to this is, even when it feels like to us there doesn't seem to be any rhyme or reason to the problem behaviors we're seeing, it doesn't make sense to us, or quote, it's coming out of the blue, or we can't expect it, we don't know when it's going to happen. It's so important to keep in mind that behavior is always meaningful and there is always a reason for problem behavior. It's always serving a purpose for that person. And so our job is to try to figure out what is that purpose? What are the fundamental needs that this behavior is addressing or trying to address for this individual with autism? But this key question, to ask when you're seeing problem behavior, what is the behavior communicating? Because when you ask it in that way, it can lead you towards strategies. It can lead you towards, opportunities for you to do something, change your behavior in ways that might be supportive of that individual. So what is the behavior communicating? When we're looking at problem behavior episodes, whether they're happening in the home or the school setting or wherever they're occurring, there's a way to analyze behavior, and the way to a basic framework for analyzing behavior is, in part, to look at the behavior itself and to be able to describe the behavior, and I'm going to talk about that in a minute. But then also to look at what's happening before the behavior occurred. And so a key question to ask here is, what was going on when this behavior happened? What was going on when this episode occurred? And so some of the examples of immediate triggers or things that might have been going on just before the problem behavior happened, for example, might be if the individual's having to wait for something that they want and they're struggling to wait for it. Or maybe they've been presented with work or academic demands or challenging work that they don't fully understand and that perhaps they have some history of failure around. Or maybe there's a threat to an established routine, like the example I gave you of that young man in high school who was receiving feedback from his AP teacher. He was responding very strongly, getting very upset about the feedback that he was getting on his written work. And so he was struggling to tolerate the criticism, the constructive criticism that his teacher was providing. In some cases, the triggers might come in the form of agitating environmental or social stimuli. Maybe it's just too loud in a particular place, or there's too much going on, and the individual is starting to feel overwhelmed from a sensory or a social perspective. In some cases, we see some of the immediate triggers that are around when the individual is encountering too much verbally delivered information. We're asking too many questions, we're piling on too much language towards them, and they're not able to process all of that. So it can cause problem behavior, or it can cause the individual to shut down and become non-responsive in some of those moments. We also see situations where, if there's a downtime and it's unstructured and the individual doesn't have better ways to know what to do with themselves, that can lead to problem behavior. That can kind of be a recipe for problem behavior when there's too much downtime and it's not structured. I'm not suggesting that individuals don't need breaks. They absolutely do, and we're going to talk about that. But when it's long periods of downtime, that can be really difficult and can occasion problem behavior for some people with autism. And then unexpected changes to routines, of course, that could be an example of a trigger for problem behavior. We were supposed to go to the swimming pool today. That was what we talked about this morning, but now there's thunder and now I don't get to go to the swimming pool. And now I'm really upset because I wasn't expecting this change to the routine and I'm struggling to cope with it. I don't understand it. I don't understand when I'm going to get to go to the pool since I don't get to go today. And that can trigger problem behavior. So these are just examples. But the point is, when we're thinking about problem behavior, to analyze it first from this perspective. What was going on when the problem behavior happened? Objectively, what was happening? Who was there? What time of day was it? What was going on in the environment? What were we saying and doing with that individual in that moment? These are key questions to consider. But underneath that, there are also other factors that influence problem behavior that may be less perceivable to us. We may not be able to see them, but they are still playing a critical role in some of the problems that we're encountering with this individual with autism. Obviously, their trauma history is critical to keep in mind, and recognizing the effects that their trauma may have on the problem behaviors that we are seeing. Fatigue, illness, family dynamics. So arguments among family in the morning might lead that child to go on to school and have a difficult day at school, in part because of what happened earlier that day at home. If the individual's experiencing, just like any of us, if we're not feeling well, and we're presented with a particular, frustrating event, we might be less resilient to that frustrating event because we're not feeling well. Whereas on another day, we might be able to handle it okay. Maybe today, we're not as able to handle it. So the same is, of course, true for children and adolescents with autism. Of course, keeping in mind things like medication changes, menstruation, or recent seizure episodes, all of those are critical factors when we're trying to assess why problem behavior is happening. And the key question here is, again, what is this behavior communicating? And some of the messages that the behavior might be saying to us is, I can't communicate my needs and feelings in this moment. I don't have a better way to communicate my needs and feelings other than through problem behavior. Or the behavior might be also communicating, I don't know what you're communicating to me. I don't understand the expectations of this activity. I don't understand the assignment I'm supposed to do. I'm overwhelmed by this activity, and I don't understand what you're saying to me. Or I don't understand the rules in this social situation, and I'm feeling overwhelmed. I can't cope with this situation. I don't know what else to do other than this problem behavior in order to get out of this situation or to get my needs met. So when we frame it in these kinds of ways, again, it leads us towards potential strategies that we can enact that will support this individual more effectively. When we ask the questions in these ways, it's looking at it through the lens of autism and keeping in mind how fundamental communication is to a lot of the problem behaviors that we see. When we see these kinds of descriptions, and I'm sure many of us have, and defiant, non-compliant, manipulative. Is he being manipulative? Is he being non-compliant? Is he defiant? Is he attention-seeking? The problem with many of these types of descriptions is, for one, these are very negative, they're subjective, and they're all about how that person's behavior is making you feel. And it's really not about you. And I know that can be hard as a parent. I need to keep that in mind for sure as well. In these moments where our children are melting down and struggling to cope, it's not about us. And phrases like attention seeking, yes, sure, the individual may be engaging in this particular behavior to some extent in order to get attention. Like, for example, we were working with an individual who he's a high school student. He is in AP and honors classes, and he pulled his pants down in the middle of class. And sure, you could characterize that in part as he was trying to get attention from his peers. And yes, absolutely, he got attention. He got a lot of big reactions. But when we just frame it in that way, it doesn't fully lead us towards the real fundamental needs that his behavior is expressing. And what those fundamental needs actually are is he is struggling to make social connections. He wants attention from his peers, yes, and he doesn't know how to get it through more expected forms. He wants meaningful social relationships with his peers and is struggling to do that. And so his role is to play the class clown, and that's the way he can try to get attention, but it's not getting him it's not leading to the outcomes that he desires. But so when we frame it in the way of he's seeking meaningful relationships but doesn't know how to do it, that can lead us towards strategies. That can lead us towards strategies that can support him in getting that interaction and social attention through more appropriate ways. And these descriptions also place all the responsibility on the individual with autism. That's another important point here. And a key mantra that we need to keep in mind is if we are trying to change their behavior, whose behavior always has to change first? It is always ours. As the caregivers or as the professionals, our behavior must change in order to affect the behavior change we want to see in that child or adolescent. So the responsibility is on us as well.
Hey, Louise.
Yeah, please.
Another question. How old does a child need to be to test for autism, really to decipher between whether it's autism or trauma? And that can obviously be pretty complex in the foster kids that we're seeing.
Yeah, well, I cannot answer that part in terms of differential diagnosis or disentangling the characteristics and symptoms of trauma from the core characteristics of autism. I'm not gonna be able to answer that part of it because I'm not a diagnostician. But what I can say is that we are seeing children who are identified with provisional diagnoses of autism as young as 14 months old. So very, very young children can be identified as having autism when they are being evaluated by expert diagnosticians. And there are many in the state of North Carolina. Our first and foremost go-to, and we can, if anybody needs information about where to go to get a good diagnosis or to evaluate for autism, you can get my email at the front of this presentation, and I'm happy to collaborate with Dr. Myers and some other folks and send a list of great folks who do evaluations in autism very, very well. And they're also really good, perhaps, at sort of differentially, separating autism from other diagnoses and other factors. But again, so 14 months, is the youngest child we're serving right now. So it's really important for everyone to understand that autism can be identified by expert diagnosticians at very, very early points for some children. I wish I could answer the other part of that, but I can't for the trauma part. It's a great question, though. So common misconceptions, are we looking at this through the right lens? Again, when we're seeing problem behavior, reframing it. So we're not describing it in terms of defiance, non-compliance. These are not the reasons for problem behavior. He's just rude, or she's trying to get under my skin, or he's being lazy, or he can do it, but he's choosing not to. Sure, I know we all feel this way sometimes when we see problem behavior. And yeah, sure, maybe on today he is choosing not to do this activity, but he can do it because he could do it yesterday. But that can't be where we stop in our assessment of problem behavior. If this is where we stop, we're going nowhere. We're going to a dead end. And so rather, if we can reframe this, for example, this last sentence here, he can do it, but he's choosing not to. Perhaps we should reframe this to, what is it about today? What has happened earlier in the day that might be influencing him and making him less tolerant to this work right now? Why is he less resilient in this moment around getting this work done than he was yesterday? Maybe is it something about the assignment itself? Has it been presented in a different way today, conceptually or otherwise? Or maybe does he need more breaks today than he did yesterday? Motivation changes, and our resilience and tolerance for things changes from one day to the next. And so if he's showing you through his behavior that he can't or is choosing not to do it right now, then it's on us to try to figure out why that is, and to maybe make accommodations and adjustment, to maybe modify our expectations in that moment so we still get a quote unquote win. But if he's showing us that he just cannot sit here for 30 minutes and do this entire reading assignment, then maybe we need to break it up. We need to break it up into a couple key questions, and then he's going to take a break, and then he can come back to it and do a little bit more. And maybe by modifying our expectations in that regard, he is more resilient and able to get it done. So reframing is really important. Again, I understand why we say some of these things, but we can't just stop here because these are not particularly helpful characterizations of problem behavior. Lead us to dead ends. And you all know this as well. And of course, as a parent, I have to remind myself of this and practice what I preach. But managing our own emotions is critical. And remembering that even in the most heated of moments with children or adolescents, their behavior is not simply intended to challenge our authority. Keeping in mind their autism, keeping in mind their trauma history, keeping in mind all those other experiences that might be influencing what we're seeing right now. Keeping in mind that in many cases, the problem behaviors they're exhibiting in this moment are reflecting a lack of coping skills that they have. And so that leads us towards strategies. Then we know from here, okay, there are coping strategies that we need to build and address to build this child's resilience. We need to teach him new skills to manage these challenging situations. And so, of course, when situations are challenging, obviously we as parents and professionals, we have to remember that our coping skills become critical. We need to have a coping plan for ourselves sometimes. You know, the other day, my husband put himself in timeout. He was like, I need to walk away. That, you know, he knew in that moment, he just needed to leave the room so that he wasn't going to continue to verbally engage our child, because it wasn't going to win. Nobody was going to win. It wasn't going to be a win situation. So we need to remember too, our coping skills. What do we need? And knowing our own triggers. What makes us really upset? What gets under our skin? And recognizing that and developing a coping plan around that. So those of you all who are professionals supporting parents, foster parents, biological parents, and adoptive parents of individuals with autism, supporting them in these coping strategies to deal with heated behavioral moments is really critical. So thinking about problem behavior, you know, this again, it involves doing the detective work. Like, what does the behavior look like in observable, objective terms? Defiance is not a behavior definition. That does not tell me anything about what the behavior looks like. Defiance can come in a lot of different forms. And so observe, you know, in observable terms, what does the behavior look like? Does it look like he's putting his head on his desk for long periods of time? Does it look like he's using profanity directed towards other people? Is he verbally refusing over and over again? What does the aggression look like if it's aggression? What forms does that behavior come in? It's important for us to define those behaviors in observable terms. And also it's critical for you all who are professionals and family members who are advocating for a child, for example, in the school setting, when you're going to their IEP meeting or their 504 meeting, or you're in a behavior intervention plan meeting, it is really important for you to advocate for the professionals who are supporting that child in the educational setting to use descriptions of problem behavior that are observable and that are objective. Because if I get a report home about my child that, you know, he was non-compliant today, I have no idea what that looks like. I don't know what that means. I need you to be objective and describe for me, what did it look like? How often did it happen? Under what circumstances did it occur? That's important information for us to have in order to be able to assess and to address problem behavior. Other key questions that we want to ask: what are some of the early signs of problem behavior? How do we know the individual is starting to get frustrated or upset? When does the behavior happen? During which activities? What time of day? With whom? When or where is it least likely to occur? That's a critical question that we don't always remember to ask. When does it not happen? When is the individual calm and cool and happy? And then also, what happens after these behavioral episodes or after these meltdowns? How does everybody respond? How are we responding during these behavioral episodes? It's important to do all this detective work, because often this helps us to understand why the problem behavior is happening. When we know the answer to these questions, it can lead us towards answers around the reasons for problem behavior, which can then lead us towards strategies to address those fundamental needs that behavior is communicating. And so just briefly, you know, again, I just want to, you know, when I went through foster care training as a parent, and we did trauma-informed training and all of those different kinds of trainings for months and months that we had to do, I remember that they briefly touched on data collection around problem behavior. And so I wanted to emphasize that a little bit with this group. It's important for us to advocate. Again, if we're thinking about our children who are being served in the public school setting, for example, we need to advocate for information to be captured in meaningful ways, objective ways. So descriptions like he's doing it all the time, or it's happening most of the day, or he never, or she always, or those phrases like disrespectful, off task, defiant, non-compliant. I encourage you to advocate for those to be redefined in ways that are observable and objective. That's really important for us to all be on the same page about that. And data can help. Basic, you know, there's a lot of different practical ways to collect data. If anyone in the audience needs some basic examples of data collection sheets, we have a lot of them. I'm happy to send you some examples that might be helpful to you as professionals or as parents or foster parents. But some basic data collection is really important. And one of the things we have found, and I know Kim Tizzard, the Director of Family Support, can speak to this as well, is when we support families in the context of IEP meetings or other school-based meetings, There can be a lack of trust and problems with communication when information isn't shared in a clear, objective manner. And so I just encourage you all to advocate for objective information. And if your child is exhibiting problem behavior in the school, then you should expect for there to be some clear data around that everybody can understand and that you can interpret and that everyone is on the same page about. So I've been talking about doing the detective work on problem behavior and trying to understand what is the behavior really communicating? When is it happening? Under what circumstances? What time of day? How often is it occurring? What does the behavior look like? What do the behaviors look like? And by doing that good detective work, it can lead us towards kind of getting to the heart of the matter in terms of how we're going to intervene around problem behavior. So it brings us back to that core question of what is the child communicating in this moment and through this pattern of behavior? Are they communicating that they are confused and frustrated by their schoolwork and they need a better way to communicate that frustration? And that also can lead us towards strategies and accommodations that we might need to put into place or the school might need to put into place around how that work is being presented. It leads us towards strategies when we ask the question in this way. What is the unmet need or fear or confusion that this behavior is expressing? What skills, based on the behaviors we're seeing, what skills do we need to teach so that this individual can better communicate, can better self-advocate, and better cope next time? So instead of doing this, what can we teach her to do instead? That's a critical question to ask because, again, it leads us towards strategies. It leads us towards proactive teaching of better skills. Because, again, when we think about individuals with autism and when we think about individuals who are in foster and adoptive situations, we know that we need to empower them with ways to communicate in all of the forms that are relevant for them. We need to empower them with self-advocacy skills. Because a lot of times when we see problem behavior, again, it may be in part because the individual doesn't have a better way to communicate or to self-advocate other than by using problem behavior to get their needs met. So how can we empower them with different tools and strategies? What coping skills do we need to teach for them to be more resilient in these frustrating or difficult situations? And then on our side, on the educator side, on the professional side, and as family members, what strategies and accommodations do we need to proactively and consistently apply to support this child's needs? So these are core questions that we need to ask. And that's where I'm headed now, is towards the strategies that are responsive to these questions. And just finally, when we see problem behavior, these strategies here are very much autism informed, but also trauma informed as well. First and foremost, being the calm in the storm, staying steady and predictable in our response, and being calm and supportive and neutral in our response. So not showing great big emotional reactions to problem behavior, because as we all know, that really does fuel the fire rather than put it out. Other important things to remember, validating their emotions in that moment, using basic, simple, rationed language that's at their level that they will understand, but labeling, identifying, you are angry, I'm sorry you're angry. Labeling and validating, that's important. Being present for them, so staying near them, with them, assuring that they are safe, but also giving physical space and giving lots of time as they need it. But being present so that they don't have to be alone, particularly if they don't have the tools to cope with a situation. If we just leave them alone to calm down without those tools and skills in place, it's not very likely that they're going to calm down effectively or quickly. And so for a lot of individuals, we have to support them through those moments. And there are ways to do that by staying calm and cool, neutral, not reacting to the behavior itself, but still being supportive of the individual in that moment. Not giving attention to the problem behavior. So for example, I was with a young child and he, was really upset. I can't remember what his caregiver, what had happened that made him so upset. But me and the caregiver were there together, and I was sort of coaching the caregiver through the moment, and he spit right in the caregiver's face. And she stayed present with him. She gave him space though, but she didn't, and she remained calm and neutral. But she didn't react to the spitting. She didn't say, no, or that's, no, sir, that's gross. She didn't put fuel on that fire. She remained present, she remained calm, but she didn't give attention to the behavior. She still attended to her child's other needs. So that's an example of, being present while also not kind of adding fuel to the flames. In some cases, it's important to give calming or coping materials to the individual in that moment that can distract and redirect their focus. That doesn't mean right after he spits in our face, I'm going to hand him an iPad and say, here you go, buddy. But he did need some tools and strategies to calm down. And so, she did he likes deep squeezes and pressure. So they did a little bit of squeezing once he was calmer and once he had stopped being aggressive in that moment. So she's trying to support him and teach him ways to get calm and to self-calm. And giving them the time they need to be calm rather than pushing for them to re-engage with us before they are ready. Don't place demands in those moments if you can help it. Don't give too many instructions or ask too many questions in that moment. Really ration our words and our language is very critical when we're dealing with an individual with autism who is also in a heightened state of arousal or in a heightened state of frustration and anger. It's really important for us to be very careful with the amount of language that we're using. Rather, we might rely on visuals, gestures, modeling, objects, and then I'm going to show you examples of visual supports that can be helpful as well in those moments. And then just re-engaging them when they are ready on their time rather than pushing for them to re-engage before they're ready to do so.
Hey, Louise. Before you move on, we had a good question I wanted to just answer before we move on to strategies, but
Awesome.
We've talked about a little bit about changing our behavior and us being the calm in the storm, as parents or caregivers. And the question was, how do we cope and how do we get our needs met to be able to do that? And I certainly would answer, that's a very personal question, what your needs are as a parent out there, what your coping strategies are and what you need. And I love the example that you gave, Louise, of your husband taking his own time out just to get a break and sort of reaching out for that support and making sure that you have a village of people that can support you to do that. But I don't know if there's anything else that you would add to that as far as how we can support those parents and caregivers to cope so they can be the calm in the storm.
Yeah, I do think it's individually determined for sure what the strategies would be. I think a lot of times it does involve disengagement, like the kind of socially disengaging. Again, it doesn't mean you're not present for your child necessarily, but disengaging from the verbal, the back and forth, the arguing in that moment. I am very tempted to do it sometimes with my own children, right? But in those moments, it does not usually lead to the outcomes that we want. I do think sometimes, in some cases, it involves a very comprehensive coping plan, and it may require some additional professional support where a professional is giving families assistance in identifying, okay, here's how we're going to support the individual in calming down. Here's exactly what we're going to do and say and not do and not say. And for you, parents, caregivers, here's what I want you to do in these moments, specifically, kind of laying that out. We at the Autism Society do a lot of that kind of coaching and work. And I know there's a lot of other providers that do as well. But sometimes it will require a team of folks kind of helping caregivers come together to figure that out. There was something else I was going to say. Oh, Kim Tizzard, do you have any? I was throwing Kim Tizzard under the bus because she's also a parent. Do you have any thoughts on, or what have you heard in terms of parent coping plans? What do parents need to think about and do? How do they stay resilient?
That's such a complicated question, Louise, because just like Leslie mentioned, we're all so different, just like our kids are so unique and different. So our own personal coping needs. So it could be anything from trying to just schedule that, whatever it is that they need, if it's going for a walk, especially if they know, they may react in a way. Of course, making sure that, they have coverage. You can't, there's so many times I've wanted to say, oh my gosh, I'm just going to go in another room and close the door because obviously I can't leave the house because I'm the only one here. And my son's, got me climbing up the walls. So But this is, and I'll touch some more when we talk about the resource specialists and how we can help. But we can actually help talk to caregivers in helping them figure out some ideas and strategies that may meet their unique needs. So we'll talk some more about that later. Thank you, though.
Yeah, absolutely. I mean, Kim is definitely teeing you up to reaching out to the autism resource specialist, and a lot of it is around, concepts of self-care and building resilience among caregivers, and just taking time for yourselves to help you kind of stay strong in those moments that are really tense and difficult. We work with some parents where they literally have a visual support for themselves that has a written out plan for what they're going to do, things to remember, sort of mantras to keep in mind, and it's hanging up in the kitchen, for example, for them. So there's a lot of different strategies that we might consider, but it is individually determined for sure. And so when we're thinking about supporting individuals with autism, promoting those core areas of social understanding and self-advocacy and self-regulation, addressing problem behavior and preventing problem behavior, but also teaching skills, it kind of comes down to this big definition of structure. And I know that any child needs structure, right? And certainly individuals with autism need structure. And certainly children who are in foster and post-adoption situations certainly need structure, calm, predictability, a caring environment, an environment and people they can trust and count on. And so structure also, as we define it from the perspective of autism, involves an organized environment, organized activities, and organized interactions, organized social and relational interactions, organized with predictable and understandable elements from the perspective of the person with autism. And that phrase of predictable and understandable from the perspective of the person with autism is critical to a lot of the strategies I'm about to show you. And what these strategies are intended to do, of course, are to promote greater independence, self-advocacy, social understanding, and self-regulation, and empowerment, power for that individual. Empowerment is crucial. When we think about trauma-informed care, empowerment is one of those key principles. We're trying to empower children and adolescents who may have historically not experienced a lot of power and control. And also from the autism perspective, we know this to be true as well. Given those core needs in the area of communication and problems with self-advocacy among many with autism, we know that we need to empower them with better ways to communicate, empower them with the social skills that they might need to successfully navigate the social world in the way that they want to. Empowering them with information presented to them in a way that they can understand it is also critical. So how can we restructure our communication in ways that are supportive of people with autism? Restructuring how we communicate. Of course, there's basic, maybe obvious strategies like using a calm tone, a normal tone, predictable tone in many cases, using a non-threatening stance and being mindful about how our bodies are communicating to children and adolescents with autism. Being concrete and really, really clear, and I'm going to show you examples of that in visual form. But being very clear and concrete with our expectations. I want you to be respectful. What does that mean? What does respect mean and look like? We need to define that for many individuals with autism. Also, we need to define that, I've found and seen for many children who don't have autism as well, defining those expectations very clearly, defining the social rules very concretely and clearly. Breaking up information and questions and directions into segmented, simple parts rather than overwhelming the individual with too much all at once. Hey, buddy, how was your day today? Come on in. Let's, what did you work on today? Go hang up your backpack. All of that can be way too much for some individuals with autism, even many who have lots of language and can communicate effectively and fluently with you. It doesn't mean that they can always process and understand what you are communicating to them. Or what you are communicating to them, sorry. Giving wait time and processing time is critical. Using visual information. And so when I say, let me go back to that, wait time and processing time, for some individuals with autism, if I say, like, hey, how you doing today? And they don't respond, you kind of expect somebody to respond in about 3 seconds. But many individuals with autism are not going to respond that quickly, but it doesn't mean they're not listening. It may mean that they're processing. And so some individuals with autism need more time. They need you to give them more time before they're going to answer you. So honoring that wait time and processing time. As you get to know the individual with autism, you can start to recognize what they need as it relates to processing time. Using visual information is critical. Your written words, pictures, images, drawings, gestures, objects to communicate, demonstrating, modeling, to support what you are saying. That's a critical strategy, using visual strategies to communicate. And then on the flip side of that, also providing that individual with autism alternate methods to support them in communicating more effectively with you. Written words, instead of relying on them to verbally describe everything to you, allowing them to respond in written form, images, drawings, demonstrating, pictures. I'm going to show you examples of that here in just a few moments. But supporting their communication to us in ways that are most responsive to those core features of autism. Again, these visuals are intended to empower and to get at some of these critical autism-focused areas, and also kind of from the trauma-informed lens as well, for sure. Social understanding, perspective taking, understanding the social world and the social norms and rules that govern appropriate social behavior. Self-advocacy being fundamental to our support of individuals with autism, and self-regulation of emotions and behavior. So some visual supports, just to give you examples of what we mean by visual supports, some answer these key questions, and often they are presented as what we would call visual schedules. They answer the question from the perspective of the person with autism of how much do I have to do, or how long will this last, or when do I get to have the things or activities I love. So here are some examples of visual supports, and I'm sure many of you all have seen these before. These become really critical for many individuals with autism, and particularly if we think about individuals who are maybe being moved into various foster placements, we know that structure and predictability and clarity is so important. And this is super hard for any child who's having to go through different placements or moving around. But so it's really important from the autism perspective that we are presenting information in a way that's visual and understandable to that child or adolescent. So for example, first then schedules. In the first example, there might be a picture of washing hands, whether it's a photograph, a Google image that you steal and place, an icon. And then in the then position, it's eat lunch. So first wash hands, then eat lunch. And so we can use these basic visual strategies to show the individual what the expectations are, what's going to happen and in what order. Maybe the child doesn't want to wash hands very much. Maybe it's, they're not very motivated to do it. But if they can see that after they wash hands, then comes lunch, that provides some clarity, some predictability, and some structure that might be more understandable to them, and that then might allow them to engage in the hand washing activity with less resistance, with more understanding. There are a variety of different ways to present this visual information to people with autism, and it's very individually determined. It depends on the individual's age and their level of understanding how to present this information. But it's just so important that we consider what are the routines and activities that this child or adolescent is showing me through their behavior or otherwise that they really don't understand or that they're not tolerating very well. And how can I restructure the information I'm giving to them? How can I restructure the activities? How can I restructure the day in ways that might be more supportive of this individual? Here's a quick example. You're not going to be able to hear the video, but it doesn't matter. It's not really relevant for this. I just want you to watch how this child clearly understands what this visual schedule is intended to convey. This is in a classroom setting. The teacher is going to show him 4 work tasks that he has to get done, and then he's going to get his iPad. And this is a child who was having severe problem behavior in the classroom, struggling to sit down for 10 seconds to do any kind of academic seated work. The teacher says 1, 2, 3, 4 first, then iPad. And the nice thing about that particular example is it's a dry erase marker, so she can change it. It can be flexibly presented. Sometimes it's going to be 2 tasks, then iPad. Sometimes it's going to be 4 tasks, then iPad. Sometimes it's going to be 6 tasks, then iPad. She's building up his tolerance to increase amounts of time with work so that then he can get to the iPad. When we first presented this tool to him, it was one work activity or even one response, one academic response, and then he would get the iPad. And then slowly over time, as he became more tolerant of the work, as he began to understand the expectations, he was much more able to engage and stay engaged in those academic activities, in part because he clearly understood how much and how long and when is it over. Here are other examples of visual supports. I don't want to belabor the point, but there's a lot of different ways you can present information, and it's very individually determined based on the level of understanding of the individual. Do they read? Can they read and comprehend written text? Can they write? Then if that's the case, then probably for the most part, you might be able to go with more of a written format. If they struggle with basic comprehension of written text, or if pictures or icons or photographs are more meaningful, then maybe that's the way to go. The length of the schedule is individually determined too. For some, as you saw before, it's a first then. For others, as you can see on this example on the right, it's a longer sequence of information. But just imagine how this might provide more clarity, predictability, and might reduce anxiety and confusion and fear for a child with autism who is also having to deal with a lot of other change in their life, as many of the children you all are supporting are. Here's another quick example. These strategies are not just for autism, though. These strategies have a lot of efficacy in the world of ADHD and other disabilities as well, because they help some individuals with autism to organize themselves around particular routines so that the caregiver or parent isn't having to walk and talk and nag them through every step. So we've developed a lot of these kinds of tools in collaboration with parents where they were having a lot of difficulty around getting ready in the morning for school, coming home from school and getting homework done. Supporting them in structuring this up, providing clarity and predictability, building independence and autonomy with some of these skills so the child clearly understands what the expectations are and understands exactly what's going to happen and in what order. And for this particular individual who I developed this one in collaboration with their caregiver with, if he got checks, if he was able to complete all these tasks and get to school by 7:50 on 4 out of 5 days, then he was earning a reward at the end of the week, like extra, big chunk of video game time. I can't remember exactly what they set up, but he understood that system. And so he was highly motivated to complete these tasks in this order. And his caregiver didn't have to talk him through it anymore. And they weren't having those battles that they were having every morning anymore, because this visual support did the talking for her. There's a lot of ways to present information in concrete visual terms that also help individuals with autism to self-regulate, to stay calm, to see the light at the end of the tunnel when things are challenging. We all of us who are, doing anything hard in our work lives or elsewhere, we persist in those things, particularly when we know when it's going to end. We can make it, we can persist if we have some sense of when it's going to be over. But if from the perspective of a child or adolescent with autism, if they don't know the answer to that, you can imagine and you can expect problem behavior to happen, because then they feel like they don't have control over the situation. They don't have any power. They aren't able to predict. But if we can concretely define visually what's expected, when are the breaks going to happen, how much do you have to do before it's done? These are the kind of really quick and easy strategies that we've supported caregivers around, particularly during this virtual COVID phase where lots of children are engaged in online learning. And so we're supporting caregivers and other people in breaking these tasks down into manageable chunks. And these are some of the simple accommodations that schools might be providing for some children with autism, or that we as caregivers might provide. There's a lot of different ways to convey this information. Here's another example. Parent or caregiver sets this up. This is around a homework routine. As the child completes each part, he takes that sticky note and tosses it in the trash. He can concretely see how much and how long and when it's over. He can see when the breaks are going to come. It's predictable, it's understandable. And hopefully, in many cases, when we're working with children or adolescents, we are also collaborating with them to say, okay, how many do you want to do? Giving lots of choice, embedding choice into all parts of this wherever we can. Again, so that they feel a sense of power and control. Control and power are such important rights for any individual to have. And we know that many individuals with autism, given their autism, may not experience that same sense of power and control. Certainly, again, if we're talking about children who experience trauma and are in foster or adoption situations, they too have likely encountered a lack of power, a lack of control over the situation. So we want to give that to them. Anticipating when breaks are needed. For some, we might need to insert more breaks. So one key thing that we all have to keep in mind, and I'm guilty of this too as a parent working with my middle child around homework routine sometimes, is I need to anticipate and know how long can he work? What's the zone of success for him that we need to stay in before we need to take a break? Proactively knowing when the break should happen before problem behavior or before meltdowns occur is critical. And everybody needs a way to say, I need a break. Everybody needs a way to say stop or all done or I don't want to do this anymore. That's, again, self-advocacy, fundamental self-advocacy building blocks would include being able to say, stop, no, I'm all done. I don't want to do this right now. I need a break. Some individuals with autism aren't going to say that vocally. And if they're not, there are a lot of other strategies and augmentative tools that we can use to give them a voice, even if it's not this kind of voice. So I'm going to show you a couple examples of that. But this is a fundamental skill, regardless of where that person is on the spectrum, that we want to make sure that we are teaching and strengthening. There are a lot of different ways to do this. These are just quick examples of accommodations that might be considered in a school setting, where the student with autism is in a general education setting, for example, and they have a certain number of break cards, like you can see over here on the left. He has 6 break cards. He can use those across his day. He can cash them in whenever he needs to. And he doesn't have to raise his hand and say, hey, Miss So-and-so, I need a break. If he struggles to initiate his communication in that way, maybe he uses the break card instead. He hands it to the teacher and he quietly walks out, goes and gets a drink of water and comes back. So there's a lot of different strategies that we can use to empower an individual with autism to communicate around the need for a break or around the need for stop or all done or I don't want to do this right now. But we want to make sure we are teaching those fundamental messages and giving them a way to say it. Because if they don't have a way to say it, we can all guess how they will communicate it. They're going to communicate it through problem behavior by flipping the desk over and running out of the classroom. So let's give them an alternate way to get those same needs met. When we think about the concept of break, this goes back to coping and teaching resilience too, is in a lot of cases when we're supporting individuals with autism, it's important to develop a written calm down strategy or, a visual calm down routine that we can practice and rehearse with that child in advance. Rehearsing it, teaching it in the context of when they're calm, so that they're more likely to then be able to use that calm down strategy or those coping strategies when they are upset. And these calm down plans can come in a lot of different forms. Maybe these are some of the same forms, calm down procedures that we as adults, as caregivers, need to also refer to for ourselves, that we model and use with the individual. I'm feeling really frustrated right now. I need to take 5 deep breaths. And you're showing that, you're modeling it, you're pointing to the visual support that conveys that. And you're validating the tool in that way too, by showing it's not just a tool for you as the child. Everybody needs these strategies. Everybody needs these calm down methods to stay calm and cool and steady. There's all kinds of different ways that we might present visuals to support calming, and they have to be individually determined. They have to be based on the individual's level of understanding. They have to be based on the individual's age. And they have to be based on the individual's preferences. So you can see here in the middle, this Disney example. This was developed for a particular child who is all about Disney characters and Disney stuff. And so for him, Disney themes really calmed him down when he was upset. So what can he do to get calm? He's referring to this written list to remember, when I'm upset, here's what I can do. So again, these often are used as accommodations in a classroom setting, but I would also say that these are really critical to practice and use at home as well. Figuring out what's a good calm down plan for the home setting. Where can the child go to calm down? What's he or she going to do to calm down? What support does he or she need from you to practice calm and to get calm in the moment where they're upset?
Hey, Louise, can I jump in for a minute? This is
Please
Alec.
do. Yeah.
I just wanted to highlight something you just said. It's with these relaxation calming procedures, it's really important to practice them. And you mentioned that, but I wanted to highlight it because when we're upset, it's really hard for us to learn these sequences. But if we practice as we are calm to do these things, then when we get upset, it's much easier to go into these routines.
It's
Thank you.
absolutely right. Yeah. Go ahead. Oh, sorry, that was it. Okay. Yeah, no, I was just gonna add too, again, like I need as a parent, and I've started to do this in the last 6 months, probably because of COVID. I've started to practice some of these calm down strategies, like relaxation strategies for myself. So to Alex's point, again, we as adults need to practice them. We need to model them. And for that child or adolescent with autism, absolutely. They are never going to learn this stuff when they're upset. It is only going to be learned in the context of calm. So building that into their day, building that into your family structure, making that a part of the daily structure. All right, everybody, we're going to practice our calm down strategies and making that a part of the routine. It's going to look different for different children with autism. For some, maybe of course, there are some children with autism and adolescents with autism who do not understand a written calm down procedure. Maybe they don't read and comprehend written text. It's just not meaningful to them. So for some, it's not going to be about what's on a piece of paper. It might be about a particular area in the house or an area in the classroom that has objects that are clearly geared towards calming down, like the trampoline or the bouncy ball. Object-based cues that show that child or adolescent, here are some of the tools you can use to get calm, to engage in some of those movement breaks that you so desperately need throughout your day. And maybe there needs to be a timer like the one you can see here, this time timer. There are a lot of applications on phones, as well as different forms of clocks and timers that you can buy that are very inexpensive, that are not your traditional clock, but rather that show the passage of time in a way that's more understandable to some individuals with autism and other disabilities. So I would encourage you, to think about maybe using those sorts of strategies for some children and adolescents. And the idea is to proactively, like to Dr. Myers's point, to proactively insert calm down routines, practice routines into every day, multiple times a day. I'm working with a wonderful mom right now, and she has a 7-year-old son, and he needs a movement break about every 15 minutes to keep him calm, to keep him regulated, so that he's able to engage in some of the online virtual work that he's having to do through the school system right now. He needs very frequent breaks in order to stay calm and cool. And so that's why it's important for, each individual child is going to need us to take that proactive approach into consideration.
Can I jump in one more time?
I love it when you do.
It's also really important to know your child, and your child may have calming procedures that they engage in. And oftentimes we don't want people with autism to look different, but they may be calming by rocking. They may be self-stimming and flapping their fingers in front of their eyes, but that's how they have learned to calm themselves. And what's wrong with that? If that calms them and keeps them from having a behavioral episode, by all means, let them do it, and work with your family and your knowledge of the individual to come up with those strategies.
Yeah, I'm so glad you said that, because the strategies I've shown are fairly traditional calm down strategies. And honestly, like Dr. Myers just said, sometimes those deep breathing or muscle tension relaxation or like visualization or listening to music, that does not float everybody's boat. And certainly when we think about autism, sometimes the strategies that folks use to calm down or to stay calm are very unique and idiosyncratic to them. So for some, like he said, it may be playing with string is really calming, or using certain sensory, repetitive behaviors. And so there's no reason to stop or interrupt that. As long as it's a safe behavior, it's not hurting themselves or someone else. That's an important thing for us to keep in mind too. And that's really true for autism when we think about a lot of strategies. We have to think about the individual, and we have to think about those unique interests, those unique sensory needs that people with autism do have. Sometimes calm down is going to look real different than it might look for you or me. Sensory accommodations, obviously I've tried to hit really hard the idea of giving very frequent breaks more frequent than you might ever imagine need to happen for some individuals with autism. Other strategies just to consider, giving proximity, considering proximity, giving them space. For some individuals with autism, they seek out a lot of sensory input, a lot of social contact, a lot of physical contact. And for some individuals with autism, that's great. For some individuals with autism, it's really important for us to help to start to teach them healthy physical boundaries so that they are safe and less vulnerable to other people. For some individuals with autism, they resist or are a little bit more wary or guarded or are responsive or reactive to physical touch. And so we have to respect those sensory needs as well. Every person with autism is different in that regard. And so it's important to just understand that and then to provide accommodations that are responsive to that particular individual's needs. So I've been talking about advocacy around the need for a break, teaching individuals with autism that you deserve a break, you need a break, building that into their day at the time and place that they need it, providing visual supports in whatever form is understandable to that particular person to help them understand what should they or can they do to stay calm, to calm down in those moments, assuring that we are empowering all children and adolescents with autism with ways to say no, with ways to self-advocate around the need for a break, around the need for, that they want to stop a particular activity. I would much rather, as a former special education teacher, I would much rather my student be able to say to me finally through a picture exchange or verbally or however, I need a break right now, rather than him flipping the table over to avoid his work. It's more important that he self-advocate than it is that he do this worksheet in this moment. And so it's just really important for us to keep those major self-advocacy goals in mind. Here's a quick video to show you another example of a way that we work to empower some individuals with autism to communicate around their wants and needs. This is a child who does not have any vocal language. He cannot speak. But for those of you all who are professionals supporting this population or foster parents who are working with a child or supporting a child who doesn't have much language or has no language, every individual with autism needs a voice. And so for some, that voice isn't going to look, it's not going to come out of their mouth. It's going to come in other forms. So this is a child who was tearing up the classroom setting, was literally tearing up the classroom. He was tearing stuff off the walls. He loved to rip and tear. Sometimes he was ripping and tearing because he didn't want to do the activity. And that was what the behavior was primarily communicating. Sometimes he was also ripping, though, from a sensory perspective. He really seemed to enjoy and to be calmed by ripping. To Alex's point, this is exactly the kind of example of an individual with autism who's calming down and using a calming strategy that looks real different from what most people would do. But what this teacher taught this child to do was she gave him a voice by putting into place a basic picture exchange communication system. So in this video, you're going to see him pull a Velcro card and it's going to say, I want RIP. That's what the picture shows and the text underneath it says. And he's going to hand that to his teacher. And that's his way of asking to go and rip something. And I want you to pay attention to where he goes and the structure that's involved around this ripping routine for him. He's putting together the phrase, I want RIP. She says, go to the chill zone. He's going into this classroom area. This is the chill zone. He loves to rip paper. So this is also a great definition of structure right here at play. This is a child who finally has a structured way to communicate with other people. It's a way that's understandable to him and that's also understandable to other people. Him being able to request, I want RIP, is replacing some of the problem behavior that he was otherwise exhibiting. He finally has a voice. He finally has a way to make his wants and needs and frustrations known. So she's not just teaching him, I want RIP. She's teaching him a lot of fundamental messages that he needs to have. It's giving him that power and control. And then he goes over to the chill zone. This is the area where he can go to calm down, to relax and chill out. And he's ripping particular kind of tissue paper. So not only has she structured up where he's going to go to rip, but she's also structured up the kinds of stuff he can rip to clarify what's okay to rip and what is not okay to rip in very concrete terms. She's got it in a Ziploc bag. These are your rip materials. And then when he's done with the rip materials, he's going to drop them into that bucket. So there's a lot of structure put into place around this. And oh, by the way, he also has a visual schedule, which you don't see in this video, that has his day, mapped out, like, math time, PE, whatever the activities are of his school day. But do you know what also is built into his school day on that visual schedule are multiple opportunities for him to get his sensory needs met. Ripping is on his visual schedule. Bouncing on the ball is on his schedule. Taking a walk is on his schedule. So she has shifted from a reactive mode of addressing problem behavior into a very proactive approach to addressing his needs comprehensively, and most importantly, giving him a way to communicate. Because if he doesn't have a way to communicate, he's going to use behavior, right, to get his needs met and to communicate. So we have about 6 minutes before I want to pause and focus hopefully on your questions. Yeah, please.
Louise, if you don't mind, I'd like to just jump on your previous video, which is wonderful. The kind of calls that we will get from parents and professionals and a lot of those that are serving in the capacity that your attendees are today, they want to do these things, but it's so hard to know where to start, or they don't have any of the information to know even what the child's interest is, or may not have that information from the parent. So it's important that those good lines of communications with the school to come up with some great ideas like this. And I want to tell everybody that's listening, there's going to be so many amazing things that Louise is going to talk about and go over. Pick the 1 or 2 things to start with, and I just think that that's super important. And just like this classroom had a structured area, it may be even trying to decide where in the current environment there can be that little safe zone or that kind of structured area. That is one of the biggest questions, Louise, that the resource specialists and I've gotten over the years, is just trying to figure out where to start and where can we even find out how the child communicates best.
Yeah, and I'm so glad you said that. Before every presentation, I try to remember to put a slide in about pick one thing, narrow your focus, and I did not do that in this presentation. And Kim is 100% right. These kinds of webinars are overwhelming because the presenter is trying to put a lot in to give you a lot of ideas to think through, but you're not going to go home and implement all this tomorrow. It's impossible. It's not realistic. So as Kim said, pick one thing, one area. Maybe for you, it needs to be, as Kim said, setting up a little calm down area that's got some calming sensory preferred materials and routines that child can engage in, and that you're practicing that and taking them over to it multiple times across their day at home or at school, so that they can begin to practice what that context is like. And then they're coming out of it after a few minutes, and maybe you have a timer around that. Maybe your first starting point needs to be around picking some basic communication messages that we need to teach that child, whether it's no, all done, I want, go, I want rip. What are those most important messages that child needs to be able to communicate, that they're not currently communicating, but they're using maybe behavior to communicate it instead? Picking a couple of messages, and then our aim is to teach it, practice it, model it, help them communicate it. If it's verbal, it's verbal. If it's visual, using the picture exchange like I just showed you, it's visual. Maybe they're picking from a little menu of 3 or 4 pictures on the refrigerator. You're working and practicing, helping them to learn how to make a selection, to exert a choice. Maybe tomorrow you go back and you're going to set up a little visual schedule for the first time in your home or your professional setting to concretely clarify for that individual what's going to happen and in what order, and giving them choice around that if you can. So yeah, pick one thing. That is so important. And as Kim said, everybody involved has to communicate carefully and closely with one another, so that everyone has the information they need about what are that child's preferences, what are their unique interests. Okay, he likes ripping, he likes water play, he loves music, he loves gross motor movement, bouncing, swinging, jumping, running. Okay, that tells us something about the kinds of calming activities we might need to engage him in. It tells us something about the kind of communication requests we might need to be targeting for that particular child. It gives us a starting point. So yeah, communication is critical. And Kim, I'm really glad you made that point about picking one thing, because I do tend to put a lot of stuff in these, and it's too much to try to go back and do it. So fundamental, and we do lots of trainings and presentations. I could spend a whole day just talking to you about the video I just showed you. How do you train an individual and support them in using a picture exchange communication system? Or how do you teach an individual to use a calming routine? I know I'm just skimming the surface here with showing you some of the basic strategies that are fundamental. But what's critical, I hope that you're seeing, there are some key things we need to be empowering these children and adolescents around. They need a choice. They need a choice in as often as we can give it to them around what they're going to do and in what order. The activities they engage in, teaching them the power of their own choice. And for some individuals, it's going to start with teaching them to, you're holding up two objects, a book and a puzzle, for example, and you're teaching them that when they reach or point or touch one of those two objects, that means they've chosen. And that's the choice that they're making. But giving lots of choice throughout that individual's day. Empowering them by using visual supports to clarify through your communication, using visuals to clarify what's going to happen and in what order, how long is something going to happen for, when are they going to get the breaks that they need, when are they going to get to access the iPad or the playground or whatever it is that they're highly motivated to access, concretely clarifying that in visual form. Advocating for accommodations around that within the school setting is also critical. I can't tell you how many times I see children who are in general education for most of their day who have autism. They might be characterized as having high functioning autism, but they need those visual strategies just as much as individuals with more severe autism. It's just that the visuals are going to look different. They're going to be more complex in some cases. We've got to give folks with autism a voice. And again, I know we're thinking about the whole spectrum of autism here. If we're working with a child or adolescent with autism who has very limited ways to communicate around their wants and needs, one of the key questions we as professionals, DSS workers, foster and adoption parents need to be saying is, what is the way my child is going to communicate? How can he get his needs met? And that's where we're obviously going to coordinate closely with, for example, a school-based services team, and specifically a speech and language pathologist, to help give ideas on what are the ways this child is going to get his basic needs met by being able to communicate, whether it's through pictures, whether it's through a tablet device, through sign language, or through a variety of, or a combination of those tools. Everybody deserves a voice, and some folks with autism do not have one, do not have a traditional voice, and so we've got to find those alternate ways to advocate around and give them one.
Hey, Louise,
so,
we had a really great question earlier that I wanted to, I was waiting till this point to bring up, but in regards to visual supports and supporting individuals with autism to understand supervised visits or respite placements and how that can be really tricky. And so just wanted to share, a strategy that I've used in the past is really a visual calendar to show, where am I going to be, who am I going to be with, and when are those things happening. And, that could be really simple, like a Monday through Sunday schedule. And, Monday through Thursday, it's school. Then at this foster placement, I'm coming back home here. And then on Friday, I'm at school, and then I'm visiting my biological mom, but then I'm coming back, to the foster placement to make that really clear. Or a respite placement, I'm at the foster mom's house Monday through Friday, and then on Saturday, I'm going to this other house, but on Sunday, I'll be back to the foster placement. And back to Alex's point of practicing, I think that's really important here, to be really showing that every day, so that the child is getting to understand what it means and and understanding what it represents, so that, you know, not just when that change is about to happen, that, oh, look, we're going to a respite placement today, you know, that they're sort of leading up to that and understanding that, you know, whose house I'm going to be at and when I'm coming home, just to, you know, especially for our kids in foster care and adoption that go through a lot of changes, you know, just really to visually show that where we're going to be and when we're going to see that person again.
Absolutely. Yeah, I'm really glad you said that, Les. Yeah, these tools, you do not just slap them up on the wall or laminate them or write it down and then the individual understands them and voila, you know, it does take practice and rehearsal and repeated practice and regular, routine, predictable exposure to them. Like Leslie said, the calendar is something to use every day in that example, not just when something big is going to change and happen. That absolutely. There are a lot of different ways. We do want to visually support and clarify those visits. It's really challenging, and it can come in a lot of different forms. Like Leslie's example, some will understand a calendar representation, others may not. And so then we may be thinking more about a first then or a first then that kind of shows first we're going to get in the car, then we're going to go see biological mom maybe, and that's the picture of biological mom in the middle. And then the third frame is the foster care home again. So it's showing what's going to happen and in what order in a concrete way to meet that child's level of understanding. It's all about trying to empower them, though, with that understanding. I'm going to jump ahead. My boss, Dr. Myers, is going to laugh because he said, yep, you put too much into the presentation, Louise. You tried to put in more than you were going to have time for, and he was right. But I do want to show you, to Leslie's point, another visual tool that we can use to prime or prepare a child for some of these difficult social expectations and some of these challenging situations that this particular population might encounter. Here are some more generic examples, though, of social narratives. We developed at the Autism Society, I don't remember how many we have on our website, but we have a lot of social narratives, dozens and dozens. And what social narratives are, or AKA social stories, but social narratives are little stories that are written from the perspective of the person with autism or to the person with autism. They are written at a level of understanding to meet that particular individual's, you know, needs and level of understanding. They're written using language and pictures that they can understand, and they're intended to explain, in this case, a particular social expectation. Here, this is all about people around me are wearing masks. And we developed this because we were hearing about a number of children and adolescents and adults with autism who were struggling when they were seeing other people wear masks, and they wanted to try to take those other people's masks off or didn't understand why they were wearing them. So we have a lot of social narratives around kind of the COVID topics of hygiene, social distancing, mask wearing, all of that. Here's another example. We have a social narrative we've developed around riding the bus, appropriate or expected behaviors for bus riding. We have an array of social narratives that we are publishing today on the website. So those will be up later today. And I developed these in collaboration with a number of other folks, clinical professionals, folks in the court system, and trauma-informed folks or trauma experts. Kind of had a number of folks look at these narratives carefully. And these are just examples. It's super important to say these are just examples. These kinds of social stories have to be individually tailored. But we're going to be putting up on our website about 4 or 5 narratives that are intended to explain to a child or adolescent some of these really difficult concepts, like I'm going to live with a foster family, I'm going to go visit biological mom, or what does biological versus adopted mean? So we have a couple of these topics addressed, and we certainly want, you know, we developed this in coordination with this particular webinar. I wanted to point you to the fact that in addition to these published webinars that are going to be, social narratives that are going to be up on the website, we've also included in the in your handouts that you all have today, a handout version of this presentation, but also I included the Microsoft Word version of these written social narratives so that you all in the audience might take them and modify them as you need to for that particular child or adolescent. Pictures are really helpful, but I think this is where the pictures have to be individualized. They cannot be generic. They've got to be specific to that particular child's situation. And so that's why we've included the Microsoft Word version. Y'all can take it, run with it, change it, do whatever you want with those. These are just resources for you. but these are intended to help explain really hard concepts in a way that for some individuals with autism can be more understandable. So with that, I just want to jump forward, jumping to the end. I've tried to present some strategies that are geared towards supporting this population around the areas of social understanding, self-advocacy, and self-regulation of emotions and behaviors. I think one continuous stream you're seeing through all these strategies is that there's some visual element to a lot of them. That visual supports tend to be a tried and true starting point in many cases. We still have to teach how to use the visuals, but they are often a really helpful tool in providing clarity and predictability and understandability to some with autism. And I just wanted to thank you all for all the work that you all are doing to support this population of children and adolescents with autism. We have a lot of other resources that I wanted to touch on as well. And this is just the beginning. You know, we're here to help in a lot of different ways to address your individual needs. So we're going to encourage you to reach out. And first, I wanted Kim Tizzard to talk about all the wonderful services and supports that her department provides.
Wonderful. Thank you so much, Louise. I'm going to attempt to put my camera on so you know who's talking to you. Apologize for a little the odd background. Anyways, just wanted to thank you so much, Louise. Such great information. I love that Louise packs it with tons of visual examples and what have you, because it helps provide you all with some possible options that you may recognize as, oh, this one might work for this particular, you know, the child that I'm working with, or this may not. So we're able to, the resource specialist can, even if you reach us, and the easiest way to find us is either to call our main 1-800 number, which you'll see that at the end of the presentation, and you'll reach our connection specialist, Nicole, and she will help get you connected to the resource specialist that's in your area. The resource specialists cover all 100 counties. And they are all parents with lived experience. They all have a child on the spectrum, the autism spectrum. And I look at us kind of like the field of dreams, you know, I'm aging myself, but they've heard it all. There's nothing to be embarrassed about. There's nothing to think that we, you know, oh my gosh, I could never ask this, or you know, I don't want to seem like I should know this answer. You're not going to get that from us. We've been there, we've done it. I remember looking at my son when he was 3 and holding his little hands and thinking, oh my gosh, I have no idea how to reach him. One of the saddest, lowest moments probably of being his mom, but it was hearing from people like Louise and Leslie and some wonderful chapter folks with the Autism Society. We do have chapters and support groups as well across the state that we'd love to connect you to too. But it was with that support that I realized that, okay, it's just going to look a little different than it did with my neurotypically developing child. So we're here to support in a lot of different ways. Currently, as you can imagine, things have looked a little different during the pandemic. We are spending a lot of time helping families navigate their school system, and that could be in a lot of different ways. Some of the children or young adults that you might be working with may have an individualized education plan or program, may not. They may have what's called a 504 or may not. Or may, you know, be in regular ed, but this is where we can help navigate that system as well as other resources. I know that we have, you all today represent a number of counties, a number of systems across North Carolina, and they all are very unique and different as to what resources might be available for you. So that's where we can help with that as well. We also can help navigate, and I see that David did put how, where you can find the autism resource specialist in the chat. So we're here to help you. That's what we do. It's what we love doing, and we hope to hear from you. Thank you. So Louise, she did put up on the screen as well that we do have a number of wonderful online resources as well on our website. So there's quite a bit on there, but we could even help you figure out what on the website would be most helpful. So we do have some great toolkits that are available. Louise talked about all the wonderful social narratives that we've developed. There is quite a few. I've lost count. They're exciting. They're wonderful. We've got some stuff for the holidays too on navigating that. You all may see, again, some resources that you want to use, but you're just not sure how to adapt them. My son in particular preferred real pictures when he was younger. And I know Louise covered that as well. And so did Leslie when they talked about ways to even make some of those visitations more meaningful, and whether it be first then or using real pictures, which is great now that we have our iPhones and what have you, makes it a little easier to even pull some of that off. We're available, so if we don't get to cover all your questions today, you can reach out to me anytime, and we'll be more than happy to help you, navigate some of those services. Thanks, Louise.
Yeah, no, thank you. I mean, and that's the thing, at the end of all this, I'm hoping that you all have a few strategies in mind. You've got some ideas. Maybe you were already doing all this, and now you've just got a few nuggets there. You want to refine something or make some adjustments. Or now you know how to go back and effectively advocate around a particular area with the school system or whatever. But if you don't know where to start, the point of all of this is that you can reach out to us, and we are here to support you. You can reach out to Kim Tizzard and the Autism Resource Specialist, as she has clearly conveyed. It's such an important resource. It's really our frontline resource is connecting with other parents of individuals with autism. I wanted to quickly make sure you did know too right now that our clinical department is offering what we call a rapid response telehealth-based consultation service. It's provided across the state of North Carolina. The reason we can provide it across the state and across any county in North Carolina is because it's telehealth-based. There are limitations on what we can do in telehealth though. But often what we're finding is that this telehealth-based service is intended to support families and caregivers around basic ideas of how do I structure up my child's day more effectively? How can I tweak and engineer? How can I develop some visual supports that'll be helpful to them? How can I get started with supporting them in their communication skills, their language development, in collaboration with a speech language pathologist maybe? How can I enhance their independence? Or what are some basic positive behavior support strategies that I might need to put into place to address some of the challenging behavior I'm seeing? This service is funded by a number of different funding streams, including the Innovations Waiver, straight Medicaid, various private health insurances, or in private pay. What I want to say too is, though, while we are here to help with this telehealth-based service, this short-term service is not intended to address extreme forms of problem behavior, and it's not intended to address mental health crisis. But if you're experiencing that, we still want you to reach out to us so we can try to either provide support to you in another form, or we can try to get you to the right services and organizations that can help you. So if you're interested in hearing more about this rapid response consultative service, you can reach out directly to our clinical director. His email address is there for you, and our phone number, the clinical line phone number, is there for you, and you will hear back from him quickly if you reach out. So we are here to help, and I know I'm a couple minutes over. It's 12, but I'm really happy to hang out, and I know the other panelists are as well, with any questions that have come through. And if you have deep dive questions, you have my email address. It's at the front of this presentation. You also know how to reach out to our Autism Resource Specialist. There's the main line contact information, but you can email me directly. And if I can't answer your questions, I will get you the people who can. We produced a blog last week that was published that touches on this topic of supporting individuals with autism in foster and post-adoption context. And it lays out some of the resources that I've pointed to in this presentation, but it also includes some external resources that are specific to trauma and that are specific to supporting children in foster and adoption contexts. And so other organizations and partner agencies and other resources and materials that have been strongly recommended to us, we've included some of those resources in that blog. I wanted to thank our panelists, Kim Tizzard, the Director of Family Support, Dr. Alec Myers, our Clinical Director, and Leslie Fraser-Ball, a clinical professional colleague with me. I also wanted to thank the Transylvania County Department of Social Services, because they reached out a few months ago asking for a webinar around this topic. And so that's where this really originated, was, well, okay, well, let's expand this. Let's expand the reach across the state. So I did want to thank the Transylvania County Department of Social Services. I encourage other DSS entities and other foster and adoption agencies to reach out. We do a lot of trainings, targeted trainings to a variety of stakeholder groups across the state. We also provide a lot of contracted trainings to school systems and other groups. So keep that in mind as well if you're in need of professional development around any topic specific to autism. Thank you all again.